Hi, Kate. I'm Rachel from Physical Therapy. We're going to talk about your precautions after surgery from having your lung transplant. Okay, so whether you have an incision on one side of your ribs or on both sides of your trunk. Okay, so a thoracotomy incision on one side, or it's called a clamshell, where you have an incision on both sides. Okay, the precautions are typically 6 to 8 weeks. They don't want you to lift, push, or pull more than 10 pounds. The tricky part with this, the most tricky part is getting in and out of bed within your precautions, okay? So I'm gonna give you this folded blanket, and you can use anything. You can use a blanket, a pillow, a stuffed animal, anything to keep your arms busy while you're doing this, okay? So if you can scoot as far back onto the bed as you can and get your knees as close as you can, perfect, okay? And you wanna give yourself a hug. Wanna keep those arms really tucked in close to you. When you lay down, we want you to go down onto your side, okay? And then you're gonna bring your legs up at the same time, kind of like a pendulum, okay? Breathing is very important, because if we hold our breath, it cuts off the oxygen supply to the brain. Keep this tucked in, breathing in, and as you blow out, try to come down onto your side and bring your legs up and stay on your side. Perfect. Once you're here, then you can roll back onto your back. Perfect. Okay. If you find that you're scooted too far down in the bed, it's very important to keep those elbows off the bed, because we tend to push. If you need to scoot up or just scoot your hips over side to side, you can push down with your feet or your heels. Scoot up, scoot over, but this way it'll keep your incision site safe, okay? Now, when you're going to get out of bed, this is probably the hardest part of everything, that any mobility, that when you're trying to keep your precautions. As you roll to your side, you can push through the heel to roll over. But before you do, check your position in the bed, because when you roll to your side, you don't want to be right at the edge of the bed where you feel like you're going to fall right off if you're too close. So make sure you have enough room there to roll over, but not so far over that you're too far away from the edge when you sit up, okay? And you'll kind of figure that out as you go too, okay? So breathing again, I'm gonna breathe in, blow out as you roll onto your side, push through your heel, perfect. Once you're here, then you can bring your legs off the bed, okay? And you can pull against the bed with your legs, and then you might need help at the beginning with this part. Want to make sure that you don't sneak that elbow out to the side and push through the elbow. You want to keep the arms tucked into the side. If you can avoid sitting in lower surfaces, it's very helpful. It's so much easier to stand up from a higher surface. So trying to avoid, when you get home, really low chairs, low couches, that type thing. No matter what surface you're sitting on, you always want to try to scoot to the edge with your hips. And if you're holding the pillow or the blanket, you can do that without pushing with your arms. The idea is nose over toes. So you want to lean forward, nose over toes, and stand up. Very nice. Okay. When you sit down, let's just come over to the chair. Once you're centered, you can blow out as you sit back down. Make sure you're all the way to the back. Perfect. Okay. All right. Even when you're scooting back and forth in the chair, you want to make sure that you're not pushing with your arms. So we don't want you to lift or lower your body weight with your arms. Okay. All right. So from the chair, again, you're not going to use the armrest. You're going to scoot forward. You can, let's try the Rocky momentum. So on the count of 3, I'm going to rock, count to 3. 1, 2, breathe in, blow out as you stand. Perfect. Very nice.